In the framework of celebration of INRE of 50 years in Vietnam, we co-organized an international conference on One Health, bringing the international experience and practices for the learning of One Health in Vietnam. So we were very happy to have about 200 participants in person and online from 10 countries discussing various topics. So we could bring some international experiences in One Health operationalization, for example, from the USA, how they managed the outbreak of H5N1 in KHOTOS in Texas, or how Kenya managing zoonotic diseases risk as the interface of people, animal, and the environment, and some other experience from the Philippines, from Japan, and so on. But it was also an opportunity for Vietnamese One Health stakeholders to show the world how different One Health projects have been implemented in this country, because Vietnam has been considered as a leading country in One Health in Southeast Asia, with experience really from the past with H5N1, moving now to a zoonotic disease in the country. So for that, the South-South exchange between different countries in Global South was interesting from my perspective. And I think that we can learn something new among the experience from different countries, both from the South and from the North. In the discussion of One Health, there was an interesting discussion to bring plant health into the One Health framework, in line with the quadripartite discussion of One Health at the moment. But also, actually, this project or this conference pay a lot of attention on some of the recent One Health initiative and project implemented by CGIAR and INRE and Vietnamese partners here, in particular the CGIAR One Health initiative that I have the pleasure to lead at the moment. Also the ASEAN INRE initiative on food system, including One Health and some other organization. So this meeting was co-organized by Vietnam One Health Partnership, which is composed by the Ministry of Agriculture and Rural Development, Ministry of Health, but also Environment and Natural Resource, and many other international organizations and Vietnamese organizations. And actually, we asked the question if we are already happy with what is happening here in terms of One Health in Vietnam. And we realized that we have talked a lot about One Health at the conference, but when you go down on the ground, little thing happening there. And this is about One Health operationalization. And we try to showcase some of the One Health site developed in Vietnam, developed in Kenya, to help the community, bringing also lecturers from university, the animal health and public health workers to work together on the ground where the One Health issue came from. And I think that is one of the direction we will pursue, and we will work more to make One Health work on the ground, and go more for the investment of One Health, because One Health needs capacities in terms of people, in terms of financing, in terms of enabling environment to make really One Health useful to prevent disease for people, animal, and the environment.